We must preserve medical, surgical and respirator masks for our frontline workers. But the idea of using respiratory coverings or mouth coverings to prevent coughing and sneezing, projecting disease into the environment or towards others, that's a mechanical process, and that in itself is not a bad idea. But that doesn't negate the need for hand washing. It doesn't negate the need for physical distancing. It doesn't negate the need for people to stay at home if there's a stay-at-home order in place. It doesn't negate the need for everyone to protect themselves and try to protect others. So we can certainly see circumstances in which the use of masks, but homemade or cloth masks at community level, may help in an overall comprehensive response to this disease. And we will support governments in making those decisions based on the situation they find themselves in terms of transmission, based on the context in which they're dealing and the resources that they have at their disposal. But above all, we must ensure that our frontline health workers are the ones who are most exposed. They're the ones that need the high performance protection in order for them to stay healthy, do their jobs and save lives. There are many articles coming out at the moment on types of transmission and pre-symptomatic transmission. I've seen one recently from, I think, Singapore, where there was an estimation that about 6% of pre-symptomatic people, or 6% of cases, may have been caused by people who are pre-symptomatic. I'm not here to question that. There are many different estimates. But the corollary of that, the opposite of that, is clearly that 94% of infections are caused by people who are symptomatic. So we have to look at what's driving this epidemic. There are always the possibility of asymptomatic transmission. There's always the possibility that we can have some element of airborne transmission. But what we have to look at is what is the main driver of this pandemic. And in this case, we still believe the main driver of this pandemic is symptomatic individuals coughing or sneezing or contaminating surfaces or contaminating other individuals. Breaking that chain means ensuring that infected individuals are diagnosed and isolated, their contacts are traced and tracked and quarantined, and that people are cared for very quickly in the system.